right, guys, let's go over what's not being talked about enough, in my opinion, when it comes to Medicare and also the U.S. healthcare system and the increasing threat of the large-scale data breaches that are happening year after year, especially ever since COVID, where more and more cyber criminals are taking advantage of the vulnerability of our U.S. healthcare systems and taking advantage of the senior population targeting Medicare beneficiary identifiers known as MBI or Medicare numbers for those beneficiaries out there. The 67 million Medicare beneficiaries are definitely under attack. So let's take a quick listen to this article and let's go over it. And I'll show you some data from the research I've been looking into about these data breaches. So this is an article from Reuters. It's Medicare under attack, healthcare data breaches increase fraud risk. This is in March of 2023, but I'm going to show you some recent cases of some large scale data breaches. But first, let's go over this article. And so stealing Medicare beneficiary identification numbers has become the latest goal of cyber criminals who see this data as even more valuable than stolen credit cards. So a South Florida man pled guilty in federal court in late January to conspiring to buy and sell more than 2.6 million Medicare beneficiary identification numbers. We're going to go over that in just a second here. And other personal information. This guilty plea was one of the first prosecutions under the Medicare Access and Chip Reauthorization Act of 2015, which makes it illegal to buy, sell, and distribute Medicare beneficiary identification numbers without proper authority. So as a part of this plea, the defendant admitted he and his co-conspirators used data mining and social engineering techniques to collect Medicare beneficiary information that he then advertised and sold online. The defendant sold the Medicare numbers and other information of 83,000 beneficiaries to undercover federal agents for $8,000, according to court records. The government estimates that he made approximately $310,000 for transactions involving millions of Medicare beneficiary identification numbers. So we're going to go over MBIs in just a second and also go over why these criminals are doing it for not only financial gain, but also to be able to use your benefits that you paid into all your working years, paying your FICA taxes, which is not a good thing, and also probably maximizing your benefits when you need those benefits, when you need it the most. So I'll get into that as well. Let's finish this article. Just to read a little bit more. So medical identity theft, including the theft of Medicare beneficiary identification numbers, often supports the filing of false claims for Medicare reimbursement that can cost the federal government billions of dollars a year in taxpayer money. The Office of Inspector General, the DOJ, have cited year after year, ever since I've been in Medicare, hundreds of millions and billions of dollars that have been falsely filed for claims that did not need to be filed, or there was a scheme to get money from the federal government program known as Medicare. Let's read on just a little bit more. Cybersecurity attacks on healthcare providers reached an all-time high, with one study indicating that more than 45 million people were affected by such attacks in 2021. Right after COVID, mind you, a 32% increase over 2020, according to U.S. Senate Intelligence Committee white paper released in November 2022. Attacks on healthcare providers are increasing because personal health information is more valuable on the black market than credit card information. Hackers can sell medical records for $10 to $1,000 per record, according to the white paper. And so this goes on to say that the Office of Civil Rights looks like over 37 million individuals' health information was exposed. And it also says that hacking is the dominant threat of the healthcare data breaches, with hacking and IT incidents involved in 75% of reportable breaches. So it also cites some instances where, like for example, a Banner Health affiliated covered entities agreed to pay $1.25 million to resolve a 2016 data breach. That means they were exploited, for having a data breach, and they paid out. So these health organizations try very, very hard to keep your data private, but if they can't, they literally will pay out these criminals, believe it or not, just so that they can have their data back. And obviously, the criminals just want to be able to profit from them. So, isn't that crazy that your data is so valuable that the criminals are literally holding it ransom for these big healthcare organizations or data or organizations that hold a lot of information? Okay, so with that said, let's look at your Medicare beneficiary identifier. That's what it talked about. Okay, so in the article, it was saying the Medicare beneficiary identifier. So that's your MBI. It's known as your MBI. It's that randomly generated 11-character identifier associated with your Medicare beneficiary number, and that's on this red, white, and blue card, right? Red, white, blue card right above me right here, and it's this number right here. Obviously, the old number back before 2018 used to be your Social Security number with a -A if you were active or taking your Social Security, but now everyone has this right here. And so they're actually sending out some new Medicare cards to folks that were affected by the Medicare.gov account creation. I believe over 103,000 beneficiaries were affected by that. So let's jump into that real quick, and I'll tell you about some large incidences of data breaches in just a second here. So let's listen to this lady right here real quick.
Medicare Services, WPS Physician Services. So if you got this letter, do not be confused. It's very long, it's very confusing, and some folks will get a new Medicare number and card, others will not. So if you have questions about this, we want you.
So this is a news report in Northeast Louisiana. And so a lot of folks were affected by a data breach from WPS, which is a Medicare administrator contractor with processes the billing and claims processing for Medicare, for your Medicare services, supplies, and durable medical equipment. And so those folks that are affected will be sent a letter from Social Security Administration, and then also there's another data breach from CMS, which affected the Medicare.gov accounts, and the sample letter looks like this, where they're writing to inform you that your personal information related to your Medicare.gov account was, obviously tampered with or created without you knowing. So if you have not created your Medicare.gov account on your own, I implore you to do so or get help to create your Medicare.gov account. It's super simple, easy to obviously create an email, get your grandson, granddaughter, or your son or daughter if you don't know how to do it or are not tech savvy. I implore you. The criminals out there are trying to get as much information from you as possible, not only your Medicare account, but also all your information that surrounds who you are, your name, your address, your birthday, your email, your phone number, and anything else that is associated with you. So they're trying to take advantage of the systems out there, U.S. health systems and healthcare system, as well as the Medicare system to exploit by any means. So with that said, let's see what the criminals are doing. Okay, so the criminals are literally doing this for obviously financial gain. They're also using your Medicare services. They're also obtaining prescription drugs off your Medicare information. They're exceeding benefit limits. I also have a story where there is and I'll tell you in just a second about someone whose death record was changed even though she was alive. And so that was tragic because she's still battling that and trying to change her death record. The identity theft, oh yeah, obviously with identity theft, they're going to be opening new accounts under your Medicare data. That includes your Social Security, date of birth, addresses, a very comprehensive set of information to open new financial accounts and even credit cards in their name, and then obtaining medical services, and then obviously selling your data on the dark web. And then here's the big one: ransomware and extortion. So healthcare organizations are often targeted by ransomware attacks, where systems are encrypted and access to data is blocked until a ransom is paid. Criminals may also exfiltrate data and threaten to release or sell if the ransom is not paid, leveraging the sensitive nature of the patient information. Isn't that crazy? So literally, our healthcare system is under attack right now. And look, it's making it very vulnerable for the vulnerability of healthcare system, where healthcare organizations often have complex and outdated IT environments, making it easier target for cyber attacks compared to other sectors. So this article was written in 2023, y'all, but that cyber attacks are literally exploding in 2023, 2024. So look here. So HCA Healthcare data breach, a hacking incident impacted 11.27 million individuals, making this the second largest data breach of all time at the time of reporting. That was in 2023. Here's the largest one. In 2024, Change Healthcare cyber attack, a ransomware attack, stands as the largest healthcare data breach ever, affecting an estimated 190 million individuals. So, the US population is around 360 million. So that's the majority of Americans out there. That's crazy. And so for you folks that just want to make sure that you have someone that you know, like, and trust, and that's where someone like myself comes in for you in your Medicare journey. If you're looking for to not only make sure that you're verifying your Medicare number, we can do that for you to make sure that it's correct. We can also help you with your Medicare insurance options and also lead you to some programs at Social Security or Centers for Medicare and Medicaid Services, like Medicare Savings programs, extra help, and then also look at reducing premiums, which is the number one thing that we have found for original Medicare beneficiaries that have Medigap insurance and a standalone Part D drug plan premium that they have to pay for individually or separately. And then for you folks that are on Medicare Advantage, the number one benefit that we're seeing out there that benefits a lot of Americans on fixed incomes is the Part B Give Back benefit. So if you want to know more about these things and want a service alongside you, your Medicare journey, I'm Michael C. Fishbach. I run and operate Medicare Savings out of Charleston, South Carolina, and we've been helping beneficiaries since 2016. So please keep your data as secure as possible. We try to do the same here at Medicare Savings. And obviously, if you're needing updates to your personal profile, It's really, really good to have a service like ours, which makes it nice and easy to verify the information with you, so that way you know you have the correct information, so that you don't have any delays in care, and also you have someone to advocate for you to review some of your claims, like your Medicare summary notice. If you're on original Medicare, you can look at that online at your mymedicare.gov account under EMSN, or if you get an explanation of benefits and you don't understand what's being approved or denied, please look into us, because we literally try to help folks that are being denied services that would normally be approved by original Medicare if you're on Medicare Advantage. So I implore you, if you don't have someone to advocate for you, please reach out to us, medicaresavings.us, or call our 1-800 number, 1-888-608-0654. If you want to become a new member, you can call our Medicare Savings line for our members and do the intake process. Our local number is 843-606-6008. Take care and God bless.